300 milligrams a day of this vitamin is so powerful at protecting the kidneys that some patients treated with it completely got out of kidney disease. In this video, there are 3 vitamins people suffering from diabetes and kidney disease should always be supplementing because kidney disease doesn't always have to go from bad to worse. Having worked with people suffering from kidney disease for almost 10 years now, I've personally met patients who were able to improve. And using the right nutrients to stop what's causing the damage is one of the most effective strategies. If you want to protect your kidneys from diabetes, the biggest danger in existence, don't miss our number 1 in particular, as it has been recently proven capable of improving kidney function and creatinine levels significantly. This is a recent study that's really creating an earthquake in the world of kidney disease. But before that, there is a hidden danger people suffering from diabetes are facing. Recent studies found out that a large number of patients are deficient in this vitamin. Unfortunately, very few doctors are actually prescribing this essential nutrient. This puts the patients at an increased risk for cardiovascular diseases, cognitive disorders, cancer, and chronic kidney disease. Number 3, a crucial vitamin you should consider supplementing is vitamin B12. Vitamin B12, also known as cobalamin, is an essential vitamin that your body needs but cannot produce. It's found naturally in animal products only. No plant food contains it. Fact, a great number of both kidney disease and diabetes patients are deficient in this vitamin, but only 6.4% were being treated with vitamin B12, according to recent study. Researchers believe that those taking metformin are especially at risk for this dangerous deficiency. So, how can you tell if you have a vitamin B12 deficiency? Symptoms of vitamin B12 deficiency include fatigue, joint pain, and dizziness. A B12 deficiency can cause a pale, yellowish skin and a sensation like pins and needles in the hand. This is because this vitamin is essential for blood formation as well as brain and nerve function. Unfortunately, B12 deficiency is very common in people with kidney disease and extremely common in those suffering from diabetes. The good news is that supplementing this vitamin may benefit your body in impressive ways. It boosts your energy, improves your memory, and it even helps prevent diseases. Most of all, recent studies found out that supplementing vitamin B12 may prevent organ damage caused by diabetes. Amazing! All this for a single vitamin. And as I was saying, this vitamin is especially useful to protect your kidneys from the danger of diabetes. The reason is homocysteine levels. When these levels are too high, they will wreak havoc in your body. An increase in homocysteine is known to be related to an increased risk of cardiovascular diseases, cognitive disorders, cancer, chronic kidney disease, and other chronic diseases. Now, homocysteine levels are known to increase if vitamin B12 levels are low. This is especially common in people with digestive disorders, but also in those following a plant-based diet or suffering from diabetes. If you are in one of these groups, talk to your doctor and get tested for homocysteine levels, as that's the best way to diagnose a B12 deficiency. In short, a B12 supplement can be very helpful if you have type 2 diabetes, chronic kidney disease, or if you are following a plant-based diet. Get checked for serum homocysteine levels because that's the best way to get the correct dose for this vitamin. Remember that B12 doesn't occur naturally in plants. Now guys, I have 2 other vitamins that were recently proven extremely helpful against diabetes and kidney damage. Our number 2 in particular is so powerful at protecting the kidneys that some patients treated with this vitamin completely got out of kidney disease. Incredible! Let's see it! Number 2, vitamin B1 or thiamine. This is a very common deficiency in people with diabetes. Remember that having even a slight deficiency in any vitamin can cause life-threatening symptoms. Low thiamine levels in particular have been linked to heart disease and blood vessel damage. And while many people with kidney problems are recommended to supplement this one, really, you should probably be supplementing all B group vitamins if you already aren't. Vitamin B1 has a little known property, a peculiar property with benefits way beyond currently recognized health effects. What you don't know yet about vitamin B1 or thiamine is a crucial fact that could literally save your kidneys. According to a recent study, taking high-dose thiamine can protect the kidneys of people with diabetes from damage. According to the authors of this study, diabetic patients in the early stages of kidney disease treated with high dose or 300 milligrams of thiamine for just 3 months saw a return to normal urinary albumin excretion. This means that their kidney disease actually regressed. Incredible! The experts say thiamine works by helping protect cells against the harmful effects of the high blood sugar levels found in diabetes. In short, diabetic patients in the early stages of kidney disease treated with high dose or 300 milligrams of thiamine for just 3 months saw a return to normal creatinine levels. But don't supplement a dose this high without a prescription from your doctor. If you have diabetes or kidney disease, take 1.5 milligrams of vitamin B1 every day in addition to dietary intake. Consult your doctor if you have diabetes and kidney disease in the early stages and you want to try this powerful treatment. Time now for our number 1. This is a vitamin that doctors are actually forbidding patients to take. But things are going to change as a very recent study was able to prove it capable of improving kidney function in patients with kidney disease and diabetes. But before I'll show you the most powerful vitamin of today's video, here are some easy tips to improve your insulin sensitivity fast. Tips to improve! Always stay hydrated. Drinking enough water may help you keep your blood sugar levels within healthy limits, especially if you also have kidney problems. It protects the kidneys in several ways, as regular water intake is needed by the kidneys to flush out excess sugar through urine. And also, choose foods with a low glycemic index. Eating low glycemic index foods is key to avoid blood sugar spikes. While foods such as vegetables, high-fat foods, and many fruits are always safe, there aren't a lot of high-carb foods suitable for people with diabetes. I have recently made a video about this. If you want to see some incredibly healthy high-carb foods with a low GI, perfect to manage blood sugar levels, watch my video up here. And also, always monitor your blood sugar levels. Testing your blood sugar at home with a portable meter is going to help both keeping your levels under control and improving. Fact: what gets measured gets managed, especially if you use a health journal to keep track of your progress. And also, add more fiber to your meals. Also try psyllium husk. Both fiber and fats are proven to slow down the absorption of sugar, protecting from a spike. But while fats are rich in calories, fiber contains none. And a good way to increase fiber consumption is supplementing psyllium husk right before the main meals. Okay, it's time now for what is probably the most powerful vitamin to fight diabetes and kidney disease. In a very recent study, diabetic kidney disease patients administered 400 milligrams of this vitamin had a significant reduction of creatinine levels and a significant improvement in GFR. These results were visible in just 2 months and persisted on the long term. Number 1 is tocotrienol, a form of vitamin E. The results of this study are actually changing the way science looks at vitamin E for kidney disease. And while this study was done on patients with diabetes in the early stages of CKD, it doesn't mean this nutrient cannot help those in the advanced stages. Actually, it's not a secret that the powerful antioxidant properties of vitamin E may have a very positive effect on hypertension, for example. Vitamin E is an essential nutrient that's important to vision, reproduction, and the health of your blood, brain, and skin. And it is also one of the most powerful antioxidants in nature. It fights oxidative stress and high blood pressure. Researchers believe that this is due to the potent antioxidant and anti-inflammatory properties of this form of vitamin E. Now guys, if you follow me here regularly, you may already know that supplementing vitamin E is usually not recommended in people with kidney problems. But as we have seen, there is evidence to show that this vitamin may be a true game changer for some kidney disease patients. In short, unless you are in stage 3 and have diabetes, focus on healthy foods rich in vitamin E, such as almonds, hazelnuts, red peppers, turnip, greens, and kiwi fruit. And ask your doctor to prescribe you tocotrienol 400 milligrams a day if you have diabetes and are in stage 3 of CKD. Now guys, what about one of the most powerful foods to fight kidney disease in existence? In my recent video, I've shown everything you need to know to use this one to stop kidney disease. Do you want to know more? Watch my video up here. And this is all for today. Thank you for watching.